Is inflammation responsible for our mental health crisis? How does this relate to things like depression and anxiety and even bipolar? How does inflammation affect our brain function? How does it explain the effects of certain drugs on the brains? How our modern day diets are influencing our brains? And what can we do about it? In this conversation, we're breaking down the powerful neuroscience of how inflammation may increase our risk for mental health issues and how this relates to things like drugs and lifestyle interventions. Maybe most important, we're going to be talking about tools that everyone can and should be implementing right now to decrease their risk for having brain related issues secondary to inflammation in their bodies and in their brains. If you're new here, I'm Dr. Austin Perlmutter. I'm an internal medicine physician, and I am fully dedicated to helping people to improve their brain function today and protect their brain function for tomorrow. If you're interested in tools and science around things like mental health, cognitive health, preventing Alzheimer's, and general neuroscience, please subscribe. It's incredibly helpful to me. This content is for educational purposes only, and because we're talking about mental health issues today, the disclaimer is if you or somebody you love is having a significant struggle with mental health issues, please seek professional help. We have a mental health crisis in the United States right now, and it is a crisis that extends around the world. In the United States, about 1 in 5 Americans live with a mental illness, and that rate increases to 26% in American females. Young adults aged 18 to 25 have the highest rates of mental health issues in the United States, and that climbs to 36% among this demographic. When it comes to understanding what is causing the most common mental health conditions, things like depression and anxiety, we have long overemphasized the role of neurotransmitters like serotonin and dopamine. Recently, especially in the case of depression and serotonin, research has convincingly demonstrated that the typical explanation, meaning there are serotonin issues driving depression, is woefully inadequate. This has prompted scientists to reevaluate the mechanisms driving our mental health epidemic. And among the alternate explanations for what is causing our mental health problems, elevations in inflammation, this has emerged as one of the most compelling hypotheses. Understanding how inflammation affects our mental state and how it is in turn influenced by things like diet and our modern day food, medications, and more, we get insight into the pathophysiology of psychiatric conditions, and we start to create an opportunity for innovative treatments that maybe we wouldn't have considered before. Let's talk about the general connection between inflammation and mental health and a little bit as to what inflammation really is. The first thing I'll say on this topic is that while inflammation generally gets a bad rap, it is absolutely essential. It is a key aspect of the immune system that is necessary to allow our bodies to fight off infections and to repair tissues. But when inflammation becomes chronic, when it starts to exist at a low, smoldering level for years and years, it can have incredibly detrimental effects across our physiology, and that includes what happens in our bodies and what happens in our brains. This chronic low-level inflammation is the most concerning type as it relates to our risk for developing and having mental health conditions. In a powerful 2024 analysis of over 585,000 people, which was published in the journal JAMA Psychiatry, it was found that higher levels of inflammation were linked to a higher risk for any diagnosed psychiatric disorder. When it comes to understanding how depression is driving mental health conditions, there have been a couple of different hypotheses that have been proposed. The best recognized of these is called the inflammatory or the cytokine hypothesis of depression. And the basic idea here is that elevations and inflammation in the body are linked to higher risk for depression. So cytokines are these tiny little molecules that are produced by our immune cells. And when certain cytokines are elevated, specifically inflammatory cytokines with names like interleukin 6 and tumor necrosis factor alpha, these seem to increase risk for developing depression. We also know that several cytokines have been found to be elevated in people who have depression. These cytokines, these molecules produced by the immune system, are believed to cross the blood-brain barrier and to influence the brain acting on several pathways that may promote depression. So let's talk about a couple of these pathways to understand how inflammation in the body, and in particular these cytokines, may influence mood. The first of these relates to neurotransmitters. Now, while neurotransmitters are not the entire story when it comes to understanding mental health issues, it is true that cytokines, specifically inflammatory cytokines, appear to act on neurotransmitter synthesis as well as neurotransmitter function. And so, specifically here, inflammatory cytokines, meaning elevation in inflammation as measured by these small molecules called cytokines, that this is correlated with a decreased synthesis of serotonin. That's really important because even if we don't think that serotonin is the primary mechanism of depression, the inflammatory cytokines also shunt the molecule that would have become serotonin, in this case it's tryptophan, into another pathway that actually may have additional negative effects on our brain function. So the first point here is that elevations in inflammation may actually mess with neurotransmitter synthesis pathways, and it may not just be because the neurotransmitter goes down, but rather what else is created, that there is an issue for brain function and specifically mental health. The second pathway that has been proposed as key to understanding how inflammation acts on mental health and especially depression is that elevation in inflammation is believed to alter activation of the HPA, or hypothalamic pituitary adrenal axis. So elevation in inflammation can actually promote activation of the HPA axis. As you probably have heard before, too much stress is not a good thing for mental health. And in particular, if inflammation is able to act on the stress pathway, in this case, the HPA axis, it may actually augment or increase those chronic stress pathways that have been well correlated with mental health issues. Another pathway, and a very interesting pathway, that links the activation of the inflammatory system with risk for brain conditions that ranges from cognitive issues to mental health issues, is that increases in inflammation appear to decrease healthy neuroplasticity. Neuroplasticity is the brain's ability to rewire itself, and in particular, inflammation appears to suppress the production of a molecule called brain-derived neurotrophic factor, or BDNF. Why that's important is because BDNF, or brain-derived neurotrophic factor, is a principal molecule involved with the promotion of healthy neuroplasticity and even something called neurogenesis, the creation of new neurons. BDNF levels tend to be lower in conditions like depression, as well as conditions like Alzheimer's disease. So the fact that inflammation can decrease the production of this molecule is absolutely noteworthy. Now, as I mentioned, a lot of this research focuses on the connection between inflammation and depression. And in full disclosure, that has been where the majority of my published research has been to date, because I actually think that this is where there is the strongest link between inflammation and a mental health condition. In the context of depression, you can see my peer-reviewed work on this subject in Frontiers in Neurology. But when it comes to anxiety, there is some data suggesting this connection between inflammation and anxiety disorders. So inflammation is linked to increased reactivity of a part of the brain called the amygdala. The amygdala is not just a fear center, although it's often called that. It's really an emotional response center. It's a hub for integrating emotional information. And chronic overactivation of the amygdala is linked to and believed to be a central driver of things like anxiety. It contributes to an exaggerated stress response and persistent feelings of fear or worry. In certain anxiety-related conditions that have also been associated with amygdalar activation, there is more consistent evidence for activation of inflammatory cytokines like interleukin-6 and interleukin-1 beta. Inflammation, again, is important because in this case, it appears to increase reactivity of the amygdala. So we have kind of a mechanism in place here where increased inflammation may lead to increases in senses of anxiety and certain anxiety-related issues by activating the amygdala. We also are getting data now for conditions like bipolar and schizophrenia. And while this data is still pretty new in terms of understanding the specifics of it, several recent publications have looked at whether inflammation is playing a role on these brain states. So, bipolar is a state that's characterized by periods of emotional fluctuation, high mood, and low mood. And data suggests that elevations in inflammation may not only contribute to symptoms of bipolar, but are actually now tethered to changes in brain networks in people with bipolar. Similarly, it's been shown that higher levels of inflammatory cytokines are seen in patients with schizophrenia. And that's not just in the blood, it's also been found in the cerebrospinal fluid. So, this is just observational data. It seems a little more compelling from my perspective to look at what happens in depression because those are domains in which we actually know that interventions, as I'll mention in a moment, can decrease inflammation and seem to have a benefit on depressive symptoms. But it's important to note that the inflammatory hypothesis here is extending outwards from depression and having some bearing on several other mental health and psychiatric conditions. So let's talk about a couple of the pathways that are involved here, and we'll talk about how this relates to things like pharmaceuticals as well as lifestyle interventions. So let's begin with pharmaceuticals. Pharmaceutical is basically talking about things like prescription drugs. We know that prescription drugs, many of them, have effects on inflammatory signaling. So, as an example, there are many drugs, potent drugs, that are used for people with inflammatory conditions. So, these are drugs like tumor necrosis factor alpha blockers. But what is also becoming very apparent is that drugs that we don't historically think about as immunoregulating or anti-inflammatory can actually target those pathways. So, let's talk about each of these. When it comes to drugs that we've historically not thought about as anti-inflammatory drugs, we are now learning there may be anti-inflammatory effects, and that may be one of the reasons why they may have a benefit in terms of decreasing mental health issues. We also know that metabolism is tethered to inflammation, and that metabolism by itself influences mental health state. But to pick an example here, popular drug right now, GLP-1 agonists, or just generally GLP-1 system targeting drugs, have now been shown in preclinical data to have an effect on decreasing inflammation. We know also, and this is from clinical observational data, that people who are given GLP-1 receptor agonist drugs, they were given these drugs in this case because they had metabolic dysfunction, had improvements in depressive symptoms compared to other treatments for those same metabolic dysfunctions that did not correlate with those benefits. So just to make this point, GLP-1 agonist drugs or GLP-1 targeting drugs may actually help to decrease inflammation, and this may be why we're starting to see data that certain people, when given these drugs, have a decrease in certain mental health related symptoms. Now, more targeted drugs that are known to be anti-inflammatory drugs would be things that would be used in states like autoimmunity. What we do know is that in certain studies that people with existing chronic inflammatory disorders, especially autoimmune disorders that are using these potent anti-inflammatory medications, seem to have benefit to depressive symptoms. Now, that's not every person, that's not every trial, but there is a signal there. It's important to say in the context of these pharmaceuticals, however, that these are drugs that are pretty much always being used for other reasons because they are potent pharmaceuticals with significant side effect profiles. So we're not necessarily using these for mental health states. And certainly my advocacy is not that we should all just go out and use these pharmaceuticals because these tend to be drugs with kind of by definition potent effects and significant side effects. On the flip side of this coin is the conversation about lifestyle modification. So, lifestyle modification, unlike pharmaceutical medications, or lifestyle modification, unlike pharmaceutical medications, is very low risk for the most part. It is more available to most people. It is often far cheaper. The effect on our physiology from a lifestyle modification compared to a pharmaceutical modification is oftentimes far less acute, and it's oftentimes far less potent, which is why you're not going to have a massive change in your blood pressure if you happen to eat a bagel or a piece of broccoli. Instead, we're talking about the effects that tend to compound over time, but in aggregate may actually be more important for our health. So when we look at lifestyle modification as it relates to inflammatory mitigation, meaning decreasing our risk for having inflammation, and for mental health benefit, there's some really interesting studies that have been published. There's a lot of research here, and if you're interested, if you head over to my website, austinperlmutter.com, there's tons of content there or on this channel. But the bottom line here is that lifestyle modification is, for most people, the most powerful strategy for preventing disease, including chronic inflammatory diseases. There are many different lifestyle modifications that a person can make that are practical. I like to focus on what I call the 6S model. And that means targeting stress, sugar, sedentary behavior, sleep, substances, and smoke. So we're going to go through each of these in detail, and I'm going to tell you why I think these are so important as tools to decrease our risk for brain inflammatory issues. And in doing so, these can be tools to help to prevent our risk for developing certain mental health conditions. This is not a binary system. It doesn't mean that if you just exercise a little bit, you're not going to experience mental health issues. But at a population-based level, these are tools that have been shown to be effective in helping to decrease inflammatory risk and to benefit mental health. So the first of these lifestyle modifications that we're going to talk about is stress. Chronic stress, that we've already mentioned, is tethered to worse mental health. Chronic stress, I mentioned that chronic inflammation may actually act on stress pathways, but chronic stress absolutely acts on inflammatory pathways. So chronic stress actually leads to low levels of inflammation over time and increases our risk for a pretty much entire spectrum of mental health issues. We could talk at length about the interventions that have been clinically studied to decrease chronic stress, but a quick recap of what has been shown to be effective is things like daily mindfulness, meditation, breath work, spending time in nature, limiting news exposure, limiting social media exposure, and as will always be the case in the context of significant mental health issues, of which chronic stress would fall into that bucket, seeking professional therapy. I have found psychotherapy incredibly helpful. I think it is an undervalued thing for most people because it is something that actually can be super beneficial in helping to decrease stress. And in doing so, is an amazing intervention to decrease our risk for inflammation-driven brain issues, including inflammation-driven mental health issues. Number two is sugar. So sugar, obviously, there are a lot of people who will say that sugar is the worst thing on earth, and some people who will say sugar is not an issue. The reality of it is that certain sugary foods have been shown to correlate with higher levels of inflammation and higher rates of mental health issues, actually a host of brain issues, including mental health issues. And in particular, the sugar food that I would avoid would be sugar sweetened beverages, or SSBs. They have absolutely no value to most people. They're packed with this basically empty calories that come in the context of usually just a ton of added sugar. And as I said before, this is a form of food that actually has been correlated with worse mental health and higher levels of inflammation. Generally speaking, any food with added sugar tends to be an ultra-processed food. There's a decent amount of data suggesting that ultra-processed foods are foods that increase inflammatory activation and also are linked to worse mental health. So if you're eating a food and there are added sugars in it, then I would say it's something worthy of at least cutting back on, and potentially avoiding altogether. The other correlate to this sugar conversation is that diabetes, type 2 diabetes, which is a disease characterized by elevations in blood sugar, is correlated with higher levels of inflammation and worse mental health. So if we're talking about blood sugar regulation, it's not exactly the same conversation as decreasing added sugar, even though there is overlap. But things that you can do in addition to eating a healthier diet to help to regulate blood sugar, to help to prevent diabetes, and help to decrease the burden of diabetes and potentially even reverse type 2 diabetes would be things like increasing fiber intake in your diet, and then getting good exercise, working on your sleep, working on decreasing stress, as I've already mentioned, and probably working with a healthcare practitioner who can help you with a strategy to target your blood sugar levels and get them to a better controlled state. Variable number three in the 6S framework is going to be smoke. So something that you're going to be hearing about from me a whole lot more in the weeks and the months and the years to come is that smoke and basically things in our air are major risk factors for brain dysfunction. And one of the core mechanisms is through increasing brain inflammation. Higher exposure to smoke, specifically PM 2.5, which are tiny particles in smoke, and air pollution in general, has been correlated with risk for dementia, depression, and anxiety. And importantly, there is so much that we can do to decrease that risk and decrease the inflammatory effect of air pollution by simply ventilating our stovetops, not using incense and candles in our homes. And if we do use them, make sure we're using them in a ventilated setting and limiting total exposure, not using air fresheners, and basically making sure that your home air purification system is set up in a way that actually matches your room size and keeps things circulating and filtered at the right rate. Variable number four in the 6S framework is substances. So, very clearly, we know that excess alcohol exposure increases risks for brain health issues. It seems at a molecular level, the way that this happens is in part by increasing brain inflammation. We could say a lot about alcohol. You can check out my other videos or articles on this topic, but the bottom line here is limiting alcohol consumption to 1 to 2 drinks or fewer per day, and probably towards the 1 drink per day if you are a female. And also, if you're going to be consuming alcohol, opt for alcoholic beverages that don't have added sugar. So, considering non alcoholic beverages, and one last variable here, don't drink alcohol late in the day because it will disrupt your sleep and it may be worse than for your brain health. So, if you're going to consume alcohol, don't drink alcohol right before bed. Variable number five in the 6S framework is sedentary behavior. Why is this the case? Well, exercise is about the best thing you can do for your brain. And on the flip side, not moving your body is actually a major risk factor for higher levels of inflammation and for a host of brain health issues, including mental health issues. Lots can be said about this again. If you check out my blog, if you check out my podcast and other videos, there is lots of content on how exercise relates to brain health and tools for incorporating more movement into your day. There are a lot of people talking about all the specifics, what you have to do. The bottom line is simply moving your body more is a good plan. If you want to take that to the next level, I think it's very important to note that specifically doing weight training for lower extremities where you have your largest skeletal muscles is an amazing way to work on the inflammation mental health correlate, because when we activate our large muscle groups, we produce molecules called myokines, which are muscle-based cytokines that can actually help to decrease inflammation. So that might be an extra bonus. If you decide you're going to do a more comprehensive exercise routine, start doing some weight training with your lower extremities. Basically, don't skip leg day. The final of the 6S variables would be sleep. Getting bad sleep is a top risk factor for basically every disease, especially brain-related diseases. We know that sleep helps to regulate the immune system and vice versa. We also know that not getting good sleep is a risk factor for the full spectrum of mental health issues. What do you do about this? My top tips would be to decrease the temperature of your bedroom, to decrease the noise in your bedroom, to decrease the light in your bedroom, to reduce stress before bed, not to have devices in the bedroom. Don't drink caffeine in the afternoon. For me, it's 2 p.m. For you, you might need to actually make that earlier in the day. And very, very important, if you're doing these things and still struggling with sleep, waking up feeling tired, needing lots of naps during the day, consider becoming somebody who is evaluated for a sleep disorder, in particular sleep apnea. We know that sleep apnea correlates with higher levels of inflammation. Treating sleep apnea decreases inflammation. So this is a powerful intervention for people who would benefit from a sleep apnea intervention. So these are the 6S tools that I think everyone should be aware of. To kind of recap this conversation, mental health issues are a major concern around the world and especially in the United States. And even though we are doing some amazing research in understanding the full spectrum of variables that influence our mental health, by and large, we have not incorporated several of these amazingly powerful pathways, including the understanding of how inflammation may increase risk for mental health conditions. So, what I would say to this is there's lots more science to learn, there's a lot to be curious about, and we're probably going to be seeing a lot more integration of this information in a clinical setting very soon. But for all of us right now, each of us should be considering taking at least the lifestyle steps to help to decrease our risk of chronic inflammatory exposure. And again, if you are having significant mental health issues, making sure that we're also bringing in professional care as needed. For more content like this, if you're interested in your brain, if you want to learn more neuroscience, make sure you're subscribed. Make sure you check out my weekly newsletter that's packed with brain specific content. And if you're interested to get all of the sources that I mentioned in this conversation, you can head over to my website and check out my newsletter/blog that covers all these topics in detail and provides all of the links to the peer-reviewed research. Thank you so much for watching and listening, and I'll be sure to bring you lots more brain science next time. Talk to you soon.